Hello friends and welcome back to PADASHETTI'S Pulmonology. Previously we have done in last few weeks or few months we had done a concept like pulmonary vines where we are integrating thoracic diseases with the radiology. Today I am coming with a new concept that is clinical pulmonology. Here we will be studying decoding various signs related to thoracic diseases. To begin with, today we'll study regarding the signs in COPD, and this will be the part one. Later signs of COPD will study in part 2 and part 3. Okay. Coming to the first sign, that is Campbell sign. So what does Campbell sign mean? It means the tracheal descent along with the inspiration in patients of COPD. So how do you demonstrate it? You keep a index finger or middle finger over the thyroid cartilage and ask the patient to take inspiration. With each inspiration, that your finger moves downwards. Along with that, when the trachea moves downwards, your finger moves downwards. So why does it exactly happen? See, normal diaphragm is a curved structure. Okay, it's a muscular structure. It's a curved structure. Okay, in patients with COPD, where there will be air trapping, there will be flattening of the diaphragm. Diaphragm becomes flattened because of the air trapping. When during inspiration, the diaphragm further tries to contract. When it contracts, the trachea is pulled down because that there is a descent. Because that descent is known as Campbell sign. Okay, tracheal descent along with inspiration in patients with COPD is known as Campbell sign. This is different from tracheal tug that is seen in aortic aneurysm. Okay. Coming to the next sign, that is tripod posture, a very famous picture of the person sitting in a tripod posture, which all the medicos know. As you can see here, the person is leaning forward, keeping his hands over the knees and fixing his shoulder girdle. So why does he do that? It's also known as dyspnea relieving posture, usually seen in patients of acute exacerbation of COPD and seen in multiple other respiratory condition, but mainly seen in COPD. So once he fixes his shoulder girdle, the length tension relationship of the muscles like pectoralis major and minor is improved. Okay, because of that they help in better expiration. Okay, and then once the patient sits in this posture, the abdomen gets contracted and the flattened diaphragm of the COPD patients tries to go back to its normal curved posture, which helps further in expiration. Okay, and it helps in reducing the residual volume so that patient is relieved of dyspnea. Okay, mainly it helps in reducing the mainly helps in improving the length tension relationship of muscles like pectoralis major and minor, and then it helps in contracting the abdomen, which helps in expiration of the air. Because of these reasons, the patient assumes a tripod posture. This is second sign. And the third sign is purselip breathing. Purselip breathing, a person of COPD learns either by himself or during a part of pulmonary rehabilitation. So what does it exactly mean? Uh, Here in purselip breathing, the person inhales through his nose or through his mouth, but exhales through his mouth via purselip. Okay, the lips are like a purse. Okay, like a purse, opening of a purse. So he exhales to that. So why does he exactly do that? So before knowing that, we should know some major physiology of COPD patients, that in the distal airways and in the alveoli, they don't have cartilage to keep it open. They're kept it open by the interstitium surrounding them. In patients of COPD, mainly in emphysema, uh, the interstitium is cut, so there is nothing that keeps it open. So that will be early collapsibility, which leads to airway trapping. So in order to prevent that, we teach purselip breathing. What happens in purselip breathing? There will be increased resistance, airway resistance. Okay, that will be transmitted in the distal airways, and it keeps the distal airway and the alveoli open, so that all that trapped air comes out. So by that, the CO2 in the body is reduced, the expiration time is increased, and the residual volume of the total residual volume is reduced, and which will helps in improved ventilation. Okay, when the person breathes through the purselip, there will be increased airway resistance. Okay, because the opening is narrowed, that causes the distal airway and the alveoli to keep it open, which helps in further expiration of the air. Okay, this is purselip breathing. Okay, thank you all for your patience listening. Further, I'll come up with the further signs. If you have any comment, please leave it in the comment box. I'll be very happy either like to solve your doubts or to like if you have any suggestions to modify the videos and other things. Okay, thank you all for patiently listening. Please share, like and subscribe. Thank you all.